every day and in every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Gouty arthritis is a type of arthritis characterized by sudden, severe attacks of pain, redness, and tenderness in the joints. It is a type of arthritis that occurs when uric acid builds up in the blood and forms crystals in the joints. These sharp crystals accumulate in the joint spaces and trigger intense inflammation, often causing the affected area to swell rapidly, become warm to touch, and produce excruciating pain that can last for hours to days. Gout commonly affects the big toe, but also occur in the ankles, knees, wrists, and fingers. Some individuals may experience recurrent flare-ups, while others may develop chronic gout, which can lead to joint stiffness, deformity, and the formation of trophy hard deposits of uric acid under the skin. The prevalence of gouty arthritis in Nigeria is estimated to be around 1.5 to 2.5% of the adult population. Let's talk about the causes, the symptoms, and treatment options on your favorite health TV talk show, The Physicians. We'll be back after the short break. Stay tuned. It's another day with The Physicians, where your health is our business and will always be our business. My name is Dr. Martina Agbere, a regular anchor on this program, and today I'm going to run it alone. With me in the studio, I have a consultant, rheumatologist. He is Dr. Hakeem Olaosebikan. He works with the Lagos State University Teaching Hospital. Dr. Hakeem, you're welcome to the program.
Yeah, it's my pleasure. Thanks
Nice
for
seeing
inviting
you
me.
after a very, very long time.
Yeah.
You're looking really good.
Yes, ma'am.
Now, we're going to be talking about gouty arthritis. When you hear arthritis, what comes to mind the most is rheumatoid arthritis,
Sure.
right?
Yeah.
And now you're talking about gouty arthritis. What's the difference between rheumatoid arthritis and gouty arthritis?
Yeah, thank you so much. Now, arthritis is just a manifestation of more than 100 medical conditions that can manifest with joint symptoms, which include joint swellings, joint stiffness, joint pain. Now, gouty arthritis and rheumatoid, they are just under those 100.
Okay.
So rheumatoid is an arthritis due to our immune system fighting our joint. It's an immune-mediated or autoimmune arthritis. While gouty arthritis is due to a chemical in the blood called uric acid that deposits in our joint and soft tissue, leading to arthritis as well.
Okay.
That is just a simple difference between them.
Okay,
But
so that is just the difference.
Yes.
So what are the primary, now you've talked about the cause of the gouty arthritis.
yes,
What is the prevalence like?
yes, as it has been said, about 1.5 to 2.5% in Nigeria, but all over the world, about 50 million people are living with gouts, okay? And it has been projected that by 2050, the prevalence will increase by 70%, meaning that it is a disease with high burden, and it has high burden, and it has a lot of impact on both direct and indirect, impact on socioeconomic, state of the country as well as individual with gout.
Okay, you talked about the prevalence. Let's talk about the male and the female. Is there any
Gout is
differentiation?
more common in male than female.
Any reason why that is?
And it's just ratio 3:1. The reason is that premenopausal women that are still menstruating, they rarely develop gout because they have a hormone called estrogen that is found to be uricosuric, that it helps them to eliminate uric acid from their urine. So they rarely accumulate uric acid compared to men. But when women now get to the age of menopause, the estrogen level drops, And so they also tend to accumulate uric acid. So what I'm trying to say is that, so male, post-pubertal male, once male person start having puberty, the risk of gout increases because we do not have estrogen as a male. But for female, less than, they are still premenopausal, they are still having regular monthly menstrual cycle, they really develop gout because of the estrogen that is protective against gout, because it helps them to eliminate uric acid through their urine, because uric acid really accumulates in there, except with the secondary gout, maybe from other things. We talk about type of gout later. There are two types of gout, primary gout and secondary gout. Primary gout means that we can really identify the reason for it. We just know that uric acid is unnecessarily elevated in the body.
Idiopathic?
Yeah, like idiopathic. Why secondary means that there are other medical conditions that cause high uric acid, like maybe kidney disease, maybe cancer, you know, all these things can cause, or maybe medication that patient has been using for something else. So when you get to risk factors, we talk about that in full.
Okay. So what areas of the body, you talk about the joints, in rheumatoid arthritis, in what areas of the body it affects, and in gouty arthritis, which areas are they?
Yes. Now, rheumatoid usually affects small joints, the hands joint, in both, in bilateral symmetrical version, that is in both hands and joints. Okay. If rheumatoid affects this right wrist, it will also affect this left wrist. Okay. If rheumatoid affects all the knuckles here on the right, it will also affect all the knuckles on the left. Okay. That is bilateral, on the same side. Okay. But gout is usually symmetrical, meaning that if it affects a particular part of the body, it might not affect another joint. Okay? And then it usually affects joints on the feet, on the legs, like the ankle that you talk about. That's the commonest site in Caucasians. Okay. But in blacks, in our own studies, knee is the commonest site of gout. Okay? Knee, but usually the joint of the feet, of the leg. Serious? Yeah, knee, ankles, and what? And the big toes.
Oh wow,
those are the commonest.
Really interesting, and most people would think that each time you talk about arthritis, the knee, all you just go through is, oh, okay, I have rheumatoid arthritis. And nobody really knows whether it's the gouty type or the rheumatoid.
And that is why patients, anybody with arthritis, need to see a rheumatologist so that we can identify the root cause of the arthritis. As I said, there are about 100 diseases that can cause arthritis. How do you know which one is which? And all of them will present with the same joint problem.
Okay, so what are the symptoms?
So for gout, the classical case of gout is maybe a young man or a middle-aged man who probably indulge in some lifestyle that will now increase the risk of having gout. What are these lifestyles like? Maybe the person drink a lot of alcohol, okay, or drink a lot of wine or spirits, okay, or patient, even if you don't even drink alcohol, you indulge in a consumption of high sugary or sweets like Coke, soda, Fanta, Five Alive, Chivita, yeah, or the patient eat a lot of seafood like shrimps, lobster, crayfish, all this tuna or sardine. Those are seafood, not normal fish. Or patient eat a lot of red meat or offals, intestine, kidney, uric. So this patient has been indulging in this type of thing and now develop high uric acid because of that. And that uric acid now leak out of the blood and get accumulated in the joint or soft tissue. Usually the ankles or the knees or the big toes, or any joint can be affected anyway, but those are the commonest joints that are being affected. Now it now develops sudden onset of pain. This pain is very sudden. It's like what we call, it just develops suddenly after that binge, eating a lot of things. And when it develops suddenly, the joint becomes painful, becomes swollen. It can also become warm, or when you touch it, or hot. Patient will tell you, can you cut that toe off? That's what they will say, because the pain is so bad, it's excruciating, it is out of this world. They will say, can you cut that part of the body off? Because its pain is so bad. And if nothing is done, it can lead to joint damage. You understand? Joint damage. So, and it is a disease that is intermittent, that it comes and goes. You may survive the first attack. If nothing is done, you see indulge in that lifestyle, you may have another attack. So recurrent attack or intermittent attack of gout can now lead to joint damage, and which can affect multiple joints, and then can cause a lump in the joint called tophus. That is like you have a good, like rheumatoid nodules, like lump. So gout also has its own lump due to what? Accumulation of those crystals in the joint, and they can have some. That is a sign of poorly treated or poorly managed or unidentified gout, and that cause some lump in the body. That is how it presents.
Okay, so talking about the lifestyle, like you mentioned, eating a lot of fish, a lot of meat, red meat, And so many things that you mentioned, it looks like it's more of the disease of the bourgeois, the rich people.
Sure. In the olden days, they used to say gout is a disease of the king or king of disease because it affects people that are the royal, in UK at that time, royal families, because they are the ones that have the money to eat all those food we talk about. But now it's affecting, it's affecting the poor as well. Because poor may also have money to buy Fanta or Coke or soda or Sprite. Okay? Poor may also have money to drink local alcohol if you don't want to buy whiskey or any kind. So it's not a disease of racial or societal status again. But in the olden days, when gout was diagnosed, it was usually found among the kings, among the, the royals. You understand? Because all this thing I talk about is their lifestyle. But the poor too can have gout. Now, there are the risk factor for gout are divided into two types, modifiable and non-modifiable. Okay. Non-modifiable risk factor means those risk factors that cannot be reversed. For example, age, as I said, it's commoner in postmenopausal women and men that are what? That are for post-pubertal men. Mm-hmm. 2, another risk factor is gender. It's generally commoner in men. 3, genetic factor. Gout can run in family. There have been some genes, which is like proteins, that have been linked with gout. So that is non-modifiable. Now, modifiable ones are things that you can, lifestyle that can be changed, such as diabetes can increase risk of gout. High blood pressure, also called hypertension, can increase risk of gout. Then obesity can also increase, because all this leads to reduced uric acid excretion. And then the other disease that maybe patient with background leukemias or lymphoma, cancers of the blood, because this leads to increased cell turnover. Uric acid is in our cells. Yeah. So when it is, then the cells are being broken down, you get this of uric acid. So people with leukemia, lymphomas, all these blood cancers, or patients on some medications, innocently using it for something else, it can now increase uric acid, like low-dose aspirin. Yeah. So people are using to prevent cardiovascular disease. Yeah. Patients that are using diuretics for high blood pressure. Patients that are using some chemotherapy like cyclosporine for cancer. All these drugs can, or even some anti-tuberculosis drugs like parazinamide, all this can increase uric acid level in the blood and can cause, gouty attack. Wow. Those are they are modifiable if one recognizes them and, improve their or modify the disease. It might be modified. So those are the risk factors for gout.
So now let's talk about the diagnosis. How is it diagnosed? If we know how the diagnosis is, we can know the treatment options also.
Yes. So that is what we as rheumatologists used to emphasize. Any arthritis complaint need to be investigated and so that we can identify the root cause. So when patients present with symptoms that is typical for gout, the next thing is to ask for uric acid blood test. There's a particular level it's supposed to be in. Uric acid actually has positive function in our body, just that when it is elevated, that is when it leads to health issues. Now, there's a particular level uric acid must be in our body. If it's above that level in the blood, it leaks out of the blood and gets accumulated in our kidneys. It can cause kidney stones, uric acid kidney stones. It can also accumulate in the joints and cause, or soft tissue and cause gouty arthritis. Now, so if uric acid is above normal, with a person with such complaint that is typical for gout, that is one way to diagnose it. 2, if patient has swollen joint, that you can aspirate fluid from that joint, you can take that fluid and send to the lab to look under the microscope to look for uric acid crystals. Okay. That is another one. Okay. Or if patient has tophus, that lump I talk about, the lump in the joint called tophus or tophi. If there are multiple, you can aspirate the tophi or tophus. It appears like a milky aspirate or yogurt-like aspirate. You can also send that to the labs, look at it under the microscope, it will show you the gout crystals. Okay. The crystals actually appear like a needle shape or pencil shaped crystals. Okay. As against there's another crystal arthritis apart from gout called pseudo gout. Okay, yes, that's another one, but that's not part of our discussion today. So if it is gout, it's a pencil shaped crystals. So if you don't take that sample, you can't diagnose it. So the definitive diagnosis is to aspirate the joints and look for synovial fluid and look for the crystals, or to aspirate the tophus, that is milky aspirate, and send to the lab and look under the microscope to look for that needle shape crystals. Now, there's a set of criteria that you can also use to diagnose it, especially in regions where there's no facility or no technology to do these crystal identifications. or maybe patient does not have swollen joints, maybe they cannot access the fluid, or there is no tophi or tophi. So if you don't, so there are other, which I don't want to bother us about, that is rheumatological tools that we can use in terms of how many episodes have you had, which joints are involved, what is the duration. Well, in order, there are some scoring systems that we use to diagnose it without the definitive. But the definitive, they can also ask them to do an ultrasound of the affected joint. It can also give us some typical changes in ultrasound that can also help us to that. Then there's a new test called dual energy computed tomography, dual CT scan. It's not available in Nigeria. So it's another way we can diagnose, particularly those patients that you cannot access the fluid or you can't access the aspirate. Those are for research purpose, not for daily clinical use. But commonly what we use is those set of criteria. And for those that have the fluid, they can aspirate the fluid or can aspirate the tophus, we can send to the lab and look at it under the microscope to, for that needle shape or pencil shape crystal, which is highly classical for gout. Okay. But for those that cannot afford the, can also do the uric acid in the blood, because uric acid can also be normal. It doesn't mean that the patient does not have gout. Okay. So that's why uric acid alone may not be enough to diagnose it sometimes.
Okay. So now you have talked about the diagnosis. If the patient's sample is taken to the lab and they find out that the crystals are
uric acid,
and there is diagnosed that the person has gout, right? So what management? How do you manage it? Treatment options?
Good. Now, treatment options are divided into two, pharmacological and non-pharmacological. When we say non-pharmacological, that is lifestyle without medication, because I said it is a disease of lifestyle most of the time. So we need to educate the patient about the disease, about what to abstain from, and what to also, do regularly to reduce the episodes of attack. Because the more attack patient has, they have the risk of joint damage, as well as cardiovascular disease. But uric acid is a cardiovascular risk factor. So people with gout have been shown to have premature cardiovascular death. They can die suddenly. Because the patient with uric acid also is a part of metabolic syndrome. Uric acid is just like part of high cholesterol, part of hypertension, part of diabetes, part of high C-reactive protein, obesity. They are all like together. So what to tell our patient is that having gout means it is not well controlled, meaning that you are at risk of cardiovascular disease, which is heart disease, stroke, hypertension, diabetes, and then even. So now what to tell our patients is that avoid all the food or drink that can trigger gout. Because even if you are being treated with medication and you are still indulging in that lifestyle, you are just wasting your time. So what we tell them that stay away from all fowls, all those organ meat like kidney, liver, wishi, all those things. They are the ones that have a lot of uric acid. Stay away from red meats. The alternative, they have uric acid, purines. We call them purine-based food or drink, because purine is the grandfather of uric acid. Purine is a chemical that when it is broken down, it leads to uric acid in our body. So tell them to avoid red meats, to avoid seafood, like not all fishes, but crayfish, what's it, the other family of crayfish? The lobsters, all those ones, they need to avoid it. So, and they must ensure that they avoid alcohol in any form.
In fact, all of them have seashells.
So all of them, they have to avoid alcohols. They must have, if they don't drink alcohol, but they drink a lot of sugary, they have to stay away from sugary things. Except they can make smoothies from natural fruits. Yeah. You understand? So that Pepsi, Sprite, all those things, Coke, Five Alive. For gouty patients, though, you understand, you need to avoid all this because it can increase their risk of having all this if they drink it.
In sample, just sugary drinks.
Yes. Okay. So there are alternatives to all these things. You can drink smoothies, you can drink water, you can drink other things that will help. Now, the other thing we tell them is that if you are on medications that can also trigger gout, and you have gout, you have to, like now if the patient is on low dose aspirin, maybe the patient has cardiovascular disease already, we tell the cardiologist, can you change to clopidogrel, which has less risk of gout. If the patient is on diuretics for high blood pressure control, we tell, can you change to something else that will not trigger gout, like all these low dose, AC inhibitors and ARBs, the other medications that are alternative that will be protective against gout. Okay. So that's what we do. We adjust also, and you tell them to drink a lot of water because dehydration can also trigger attack. If the patient is too dehydrated and you already have a risk factor for gout, dehydration can trigger attack. So we tell them to drink a lot of water and avoid food or lifestyle that will increase the risk of attack. Now, after that, we now start medication. Now, if they are coming with acute flare-up of gouty pain, we give them drugs that help to calm the attack. So those drugs, we call them anti-inflammatory drugs. Because of, I can't be saying that on the TV, so we give them drugs that help to calm the attack. You understand? But that drug is not the final, okay? But we now also, when the pain is now less, or they are not in pain again, we now start drugs that help to reduce uric acid itself, which is the primary problem. So when they are having an attack, we don't usually give uric acid drug that help to lower uric acid. Because if you do that, they may have more attack. Because uric acid will be released more. So what we do that when they have attack, give them drug that help to calm the attack. We call it anti-inflammatory drugs. There are different types. We can combine two or more depending on how bad the patient. We also consider the cardiovascular other disease that they have because they can have comorbidities. Okay. Then after that, we now give them a drug that reduces uric acid, and that one there are different types as well that we can give them. Then after that, if they are not doing well, they are also we can escalate to other options. It's just that the higher the options, they are the expensive dose. There are the new medication that has been approved for gouty attack, but they are not available in the countries, and some of them are in millions of naira. So it's better not to even have it. That will tell our patient, because when we have gout, you may not be able to afford to even manage it in the first instance. So and it's a disease that can be prevented in any way.
Okay, that is very interesting. Hearing that can actually be prevented probably from as a result of the lifestyle.
Sure, lifestyle change.
In managing gout, is the treatment for life? For those that are going to be using medication, is this for life?
Very good question. Yes, treatment is for life. Particularly, drug that is used to reduce uric acid is for life. The other drug for anti-inflammatory medication for pain or attack, those ones are not for life. Those ones are just but the gouty treatment is for life, because if you don't, particularly for those that have inherent hyper production of uric acid, there are two mechanisms. So people their body actually produce uric acid themselves, and some they get more uric acid from what they eat or drink, and some their problem is under restriction. They cannot excrete uric acid. So all this category of people, you just have to be on drug forever. And with lifestyle, but it's only the uric acid lowering drug. It's just like most arthritis is forever. They are on drug forever. Okay,
so you talked about a particular drug that is not available for treatment, newly made, is not available in Nigeria. So are there new developments in gout treatment?
Yes, there is. Yes, for example, there is a drug that is called Anakera. Is a big name. There's one that is called Olaosebikan. There's one that is called canakinumab. These are drugs that help to inhibit interleukin-1. Interleukin-1 is a molecule in the immune pathway that helps, that's usually secreted when one has gout. So what it does, what those drugs do is that they help to neutralize that molecule alone, while preventing while preserving other molecules that are beneficial in our body. That type of drug is not available in Nigeria. But there are new drugs that have been approved for gout, especially for refractory, those that are not responsive to standard therapy or standard treatment, which is the one I just talked about. There are also drugs that are being approved for uric acid lowering as well. There's a drug we call as buricase, pegloticase. They are not available in the country. Okay. But they are for severe situations. Those ones that have a lot of lump, they help to dissolve the lump, but they are not really available.
So what it means is that if a patient has things that are in line with arthritis or whatever pain, joint pains, yes, swellings, the best thing is to go to the hospital so that the proper diagnosis can be made. And like you say, you have over 100 medical conditions under arthritis.
Sure,
right?
sure.
So it's good to always know the one that we are dealing with, because a treatment for a particular one will not be the same with the other one. So let's not just assume. Thank you very much, Dr. Olaosebikan. Because you have any final word of advice for our viewers?
Yes. So gout is important in the sense that it's common in men, and we don't want our men to be disabled, because untreated gout, undiagnosed gout can lead to disability, and it can also lead to premature death. And our men, they are the breadwinner in most cases, so we want you to live longer, so that you can contribute positively to both your family and society. So I want you, if you know you have risk factor for gout that I've listed, try and abstain and stay away from all this, and you'll be fine. Thank you.
We didn't talk about familiar history. Is it familiar?
Yes, I said there's a family history, or it can be familiar too, but even if it is familiar, once you live good life, the effect, you may not have it. It's for those that live, risky life, they are the ones that may likely have it, despite, and in addition with the family history that they have already acquired from their parents.
So thank you very much, Dr. Olaosebikan, for coming on our program. It's actually a thing of joy, always having you discuss very, very important topics with us. Well, like I said earlier, we don't have enough rheumatologists in Nigeria, even in Africa. It's a privilege of having you as our guest. And we look forward to having you again, because we have a lot of topics that we need your expertise on. So we really appreciate you.
Thank you.
And viewers out there, thank you for being part of our program today. Remember, the physicians, you are always on our mind. This is a station where the program where you always get very, very important information about your health. Just a click, you'll be able to get enough of everything from us on our channel. My name is Dr. Martina Agbere, but before I let you go, remember to always call somebody whenever you want to watch the physicians. You heard what Dr. Olaosebikan talked about Gouty Arthritis. It's not a disease of only the people that are bourgeois. Family history is also there. But the fact that you have it in the family does not mean that you are actually going to have it. So your lifestyle matters. If you're part of those that always take a lot of alcohol, a lot of food, fish, meat, and even crayfish, as small as crayfish, seafood, these are actually risk factors to having Gouty arthritis. Remember to follow us on social media platforms. We have enough episodes, about 300 episodes on our platform on YouTube. You can always, in your free time, just go there, click on it, and listen to other episodes that have been transmitted in the past. My name still remains Dr. Martina Agbere. Till next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, you jump back supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.